Hello, everyone. I want to thank you for joining us here today. My name is Bruna Lousada, and I am the European Manager with Teledyne Hanson, and I'm very, very happy to introduce this webinar, which is in vitro permeation as a development tool for transdermal and topical patches, with Dr. Julia Lodder-Gadaczek, the laboratory head in the R&D department at LTS, and she holds a degree in biochemistry and a doctorate in molecular biomedicine. LTS is a market leader in non-invasive drug delivery, and Julia's lab is responsible for almost every in vitro permeation study at LTS. So before we begin, I would like to remind you that all attendees are currently on mute, but you can submit your questions at any time using the Q&A section at the bottom of your screen. We will do our best to address all of your questions at the conclusion of this presentation, but if we run out of time, we will follow up with you directly via email. And if you experience any issues with your audio or connection, we recommend that you log off and try to log back on. One last thing, you should know that this presentation will be available for replay on the Teledyne Hanson YouTube channel in a few days. And with that, I would like to welcome Julia to take over the presentation.
Thank you, Bruna, for your introduction, and good morning or good evening, everybody. Welcome to my talk today with the topic in vitro permeation as development tool for transdermal and topical patch design. As Bruna mentioned before, I'm Julia Lodder-Gadaczek, and I'm a laboratory head in the R&D department at LTS. Today, I want to give you a short but deep view into the development and essential of the individual design of in vitro permeation studies during a development of a new transdermal patch or topical patch. Hope you will enjoy this session. The LTS is the global leading company for the development and manufacturing of transdermal therapeutic systems and also for oral thin films. Because the technologies are special and the use is a not so common dosage form, LTS formally working as a B2B partner and provides all services from the early stage of development to the manufacturing of commercial products. In this webinar, we will discuss and hopefully I can explain you patch designs, the role of skin in vitro permeation studies, and I will show you different examples of the design of an in vitro permeation study, answering different questions during a development of a transdermal or topical patch. Let's start with a closer look into the mechanism of API release from a patch through the skin. Everything starts with the application of the patch to the skin. Patches can be designed occlusive, which can have an enhancement effect and derives in a higher release of API from the patch, or can be non-occlusive, which is often chosen for a topical patch application with a high flexibility in the backing layer, if necessary, for example, to apply them on a joint as a local topical patch. After application of the patch, the liberation of the drug from the patch starts, and the absorption of the drug into the skin begins with overcoming the stratum corneum barrier. The drug will distribute in the skin or permeate through the skin. And in case of a transdermal system, the drug is then uptaken into the vesicular system located between the epidermal and dermal layer. After elimination of the patch, normally the permeation rate reduces rapidly. If you have such a depot effect in the skin by a very lipophilic substance, for example, there's a several-hour holding time, and this may have a benefit in chronic treatment without a drop-down effect by changing the system. Patches can be designed in many different ways, depending on API properties, stability, application time, release rate, and it is chosen individually for every new drug and patch design. The simplest and the most common design is a monolithic TTS, where the drug is directly included in the adhesion. Normally, the drug will be solubilized in this adhesion, and so the adhesion itself needs very good solubility properties like acrylates. You have the possibility to modify this monolithic transdermal systems by, for example, adding a skin layer for protecting or a membrane for release rate control. After this very short introduction about patch design, we will now come to the role of skin. Most of the transdermal patches passes the skin through the intracellular route. This is a passive diffusion along the lipophilic double layers in the skin. For this, the drug must have special physicochemical properties. Molecules cannot be big, substances must be lipophilic, but not too much. There must be a kind of polarity because the API will be transported by passive diffusion along the alkyl chain in these structures. And we always use the free base and not the salt. The follicular route and also the intercellular transport are not so important in cases of a transdermal drug system. You may only see an effect on the follicular route if you have, for example, a liquid API. For in vitro permeation studies itself, we evaluated a lot of different skin types as barrier function. And the most predictive one, of course, is using human skin. We have to handle the biological variability of the human skin, and that can affect the results of an EVPT study too. So, for example, in an early stage of development where we want to differentiate formulations by evaluating their performance, it's sometimes necessary to set a reference at some time point to have a better interpretation of this EVPT studies. The biological variability in the human skin is caused by the gender, the age, the tissue regions you want to use, and also the dermatological quality. A good alternative for the early stage of development would be the use of mini-pig skin. The mini-pig skin itself has a high comparability to the human skin, and in the most cases, we have very similar permeation results. We normally test this in a side-by-side experiment, and because we have similar breeding conditions and also the same genetic background in this animal model, we normally don't have a high variability from animal to animal, and we can use this normally without a reference. For in vitro permeation studies, we use a classical static diffusion cell. You can see in this example of a diffusion cell from Hanson microarray system that we have the principle of two compartments. We have the donor compartment where you apply the drag or patch, and we have the acceptor compartment, including an aqueous buffer system with pH values depending from 5.5 and 7.4 to mimic the transport in the vesicular system. As barrier, the skin is clamped between the donor and the acceptor compartment. Temperature is normally kept at 32 degrees, which is the skin surface temperature, and we choose the sampling time points individually, a little bit dependent on the application time and also on the solubility of the APIs, because we have to guarantee perfect sink conditions for the in vitro permeation trials. In a very early stage of development, EVPT studies are necessary as selecting tool. You have the possibility to differentiate the formulations by performance in terms of lag time, Cmax, release rate, steady state rate, and normally this is dependent on the adhesion you use, the permeation enhancers you will include in your formulations, and the API itself. And you can choose with the first EVPT studies you prepare what you want to have, and then go further with the investigation of these formulations. The EVPT studies itself should be designed individually for new API formulations, and there are some options to verify this. You have the possibility to vary the skin, so you can choose another skin model or another skin thickness. you can vary the acceptor, but you also have the possibility to vary the diffusion self itself. In this example, we made a side-by-side experiment with an open cap and a closed cap system. And you can clearly see that with the open cap system, you have a higher release of the permeation rate. But with the closed cell system, you can see here that you have a residue content in the skin. The choice of the design you want to take is individual, dependent on the expectation of the in vivo results and the best fit of in vivo to in vitro permeation. I mentioned it before, if you use human skin, we have a high biological variability, which is to handle. You can see in this example where we have the application over 7 days on different skin donors for one formulation that the variability can be high. Because of this fact, we established 2 parameters which we investigate in the skin before using for EVPT studies. We normally measure TEWL values, and we also measure the permeability of every individual skin donor. And we have something like a categorization or rate we use. And so we can select the skin on what we want to see. For early development stage, for example, we use skin with similarity properties. Or if we are in a later stage and we want to see something like a bioequivalent study in vitro, we can select then skins with different properties. If you are in a later stage of development, you normally are familiar with your target flux. So in this example, you can see we have a target flux from 10 to 12, and you have the opportunity to select the best steady state rate of your formulation reaches this target flux. In this explanation or in this example, we choose this in vitro permeation study to choose the best formulation for the preclinical study. For the development of a generic formulation, for example, the design of the EVPT study normally fits to the original product and the known release rate of this product. If you have a well-established EVPT design, it's very easy to find the prototype which fits perfectly to the reference, like in this example where the prototype A has the same kinetic profile like the reference. In the last example, again, we have a change in the diffusion cell. So we use here a cap which is heatable, and the question was, what does make the release during a sun bath on application time? So we heated the surface on the cell at 40 degrees for 8 hours and then have a resting period of 16 hours with a surface temperature on 32 degrees again. You can clearly see that we have a high increase of the target flux and a decrease in the non-heat period. At the end, the concentration level is not as high that we have this real increase of the target flux, but you can see that it's more or less empty at the end. And so with this investigation, and to keep this in mind, it can be that you have to claim the use of this patch or this individual patch during a heat exposure. To sum up, EVPT studies are necessary for the development of new transdermal therapeutic systems and also for topical patches. And it's also a kind of control of quality if you want. The in vitro permeation setup design is essential for the development and the in vivo imitation. Semi-automated systems like the Vision Microet support the opportunities for a very good kinetic profile. I'm now at the end of my presentation, and I want to thank Bruna for the opportunity to give this webinar today, my R&D heads, and of course, I want to thank you, my lab, which generate all the data I presented today. And now, thank you for listening, and I'm happy to answer questions.
Okay, that was very good. Thank you so much, Julia. It was an excellent presentation. I'm sure it was very interesting to our audience. So as Julia said, now we will open for questions. Just a reminder for everyone, you can submit your questions using the Q&A button at the bottom of your screen. Thank you. Okay, so Julia, here's the first question for you. I'm not sure you mentioned during the presentation. So what type of media do you use? I think you're on mute. Yeah.
I think I already answered chat, but normally we use buffer systems with a physiological salt concentration, and the pH is a little bit dependent on the API solubility. And normally we use the pH between 5.5, which is the pH of the skin surface, or up to 7.4, which is the pH of the blood.
Okay, thank you. Another question, what is the runtime for the diffusion? So in hours, what's how long is your test?
It's a little bit dependent on what you want to see. So it's dependent on the patch application time. So if you want to have a patch which is only applicable for 1 day, we only run our EVPT tests for 24 hours or sometimes for 48 hours, up to 7 days normally.
Very good. What adhesives do you recommend for a hydrophilic, moderately, and highly lipophilic drugs?
I think you cannot answer this in general. It's a little dependent on all the physical-chemical properties of your API, on your application time, and then also solubility of the API in the adhesion or not, and the tag you want to have. So I think you cannot say this in general. It's part of the development.
Yes, one fits all type of approach. For a preliminary test, do you use any type of synthetic membrane?
Sometimes.
Yeah. What type of synthetic membrane?
We use a synthetic membrane, EVA membranes. Normally, it's ethinyl vinyl acetate. But you only can use it if you have only the property to look what the release of your drug is, because in any case of using a permeation enhancer, for example, it doesn't work anymore. So this is only for a very, very early development stage.
How did you heat up the patch and maintain the temperature at 40 degrees?
Okay, I think there are different ways to do it. It's according to the FDA guideline for the heatable studies. I think there is opportunity to use infrared system. We have a very special designed heatable caps. It's our own design, and so that's what we use for this.
I wasn't aware what is the need to heat up to 40 degrees?
Yeah, it's sorry. It's a requirement from the FDA guideline that you have to show, for example, if you want to show a bioequivalence between an original product and a new product, that the heat exposure on the skin doesn't influence the release of the drug. So, for example, if you use a heatable jacket or you go to the sun or something like that.
Can we get 100% release from a patch?
No. If you have a very well-designed patch and a very releasable API, then you have something about 70%, but in any case, you need a concentration gradient until the end of application time, and so a 100% release is not possible.
Mm-hmm. Okay. How long can we run IVPT without letting it compromise the skin barrier?
So,
have you done any studies on skin barrier?
Yeah, we tested a lot of times, and so we can use it for 7 days. So it might be that the skin can be too thin. So I think you need 800 to 1000 micrometer skin thickness for that. And you have to prove the intact barrier function with TEWL measurement at the beginning and at the end, but 168 hours, so 7 days are not a problem at all.
Do you filter the samples after diffusion before to use HPLC as your analytical technique, or
what we do with the samples before?
If you have to filtrate.
Yeah, normally we do this because there are a lot of residue contents from the skin itself. And so what we normally do is filter or centrifuge the samples before measuring via HPLC.
Is it possible to justify new formulation if there is no equivalence between the reference product and the prototype formulation? I don't know if also do bioequivalence.
Yes, we use it often for a new development approach without any references, and then at any time point we set one of the new formulations as reference to see how big is the variability from skin to skin, to have something like a benchmark. That is what we do normally. Yeah, but it's not a problem. We use it in, I think, 80% or 90% of all development steps as a new development tool, and not only for a generic development or something like that.
At the present, there is no straightforward guidelines for IVPTs of transdermal patches. Can we follow the topical dosage form guidance?
The FDA guidance? I'm not sure which guidance.
Yeah.
I think in Europe, there is guidance for transdermal and topical patches, which include all the necessary information you need. And in the US, it's the FDA guidance for transdermal topical. I think it's a draft version of 2019. And the new guidance for topical patches excluded, for topical application excluded patches. So this is normally not the case, what you have to use.
Okay. There is a question here, but I'm not sure if it's not related to what we're talking, which is patches, but someone is asking, can we perform IVPT for ophthalmic dosages, example ophthalmic ointments or suspensions? The answer is yes. I mean, we have customers working with all these types of ocular delivery. So just, I don't think you work with any of those type of applications, but just to answer that question here as well. There's a lot of questions, so let me just scroll down here. For discrimination study based, discriminating permeation is acceptable of concentration based. I'm not sure if this is clear. Another question, sorry. What is the significance of stress temperature studies after Jmax is achieved?
I'm not sure if I understand the question.
Okay, I'll repeat. Yeah.
So I think they mean the heatable studies.
I think so, yeah. Stress temperature studies, so heatable. So after Jmax is achieved, what?
Yeah, I think there is an influence in the Jmax. I'm not sure. I think I don't understand the question. So you normally run the study with a baseline condition and the heatable conditions, so 42 degrees, so that's normal, the temperature you use. And then you have to look at every time point of application if there is a significant difference or not.
We need this testing for release, basically production batches in quality control testing. So what type of tests then you have to do during the batch release in QC? After you developed your in R&D?
Yeah, I'm sure. Yeah, it's dependent in which in which country do you want to submit. So FDA and European submission is different. So in Europe, you have to follow the permeation in vitro permeation trials during the stability. And for the FDA, this is not recommended.
Do you see the excipients penetrate across the skin and interfere with the analysis? How do you get rid of the skin content from interfering with your analysis?
I think they mean excipients, they mean penetration enhancers or something like that, or part of adhesion. Yeah, so normally what is the easiest way to differentiate is that you apply a placebo without API. That would be the easiest way if you have available. Or you can add some components, like if you know you use a penetration enhancer, which is directly penetrating through the skin, then you can include this in your buffer system, for example, and see what is the difference between UV spectrum of this penetration enhancer and your API, for example, and then it's easy to manage this.
Can we get rid from the oil content to enter into the HPLC?
From the
oil content they mean.
I'm not sure which is the oily content.
Yeah,
there is no component from the skin which is oily in the acceptor medium, so you are fine with this. If we sometimes want to measure solubilities of an API in a special enhancer, which is oily, then we normally use an organic solvent to dilute it, and then it's not a problem at all to measure it on the HPLC.
Perfect. Do we need to apply exact orifice area patch size, or can it be reduced smaller than that, smaller than the orifice size in the diffusion cell?
Normally, we do not apply the original patch size because you only have the possibility to apply on a diffusion cell something about 1 to 2 square centimeter. You must be sure if you want, for example, show equivalence of 2 formulations, that the API concentration in your punched patch is the same for comparability.
Okay, so we normally do smaller than the orifice size.
Normally smaller.
Yeah, normally it's smaller. That's okay. Okay. Lots of questions, they don't stop coming. 1 second. Is transepidermal water loss enough for skin integrity testing, or any additional parameters are mandatory or recommended?
Yeah, I think transepidermal water loss is one of the recommended qualification parameters of your skin integrity test during the guidelines for transdermal patch application.
How do we derive superiority efficacy claims for IVPT? I don't know if this is very clear. Do you understand the question? Okay, maybe they can send the question again. I think we're approaching here the last question. Let me see, there's some more coming up. In order to show that our topical patch is superior to competitor, how can the IVPT tool be used?
It's a little bit dependent on which parameter it's maybe superior. If you know that it might be the release rate, for example, then it's easy to show it with the EVPT tool normally. But in kind of topical patches, you even have to know that not in every formulation you see directly the API concentrations in the acceptor medium. You also have to look for the residue content in the skin, for example, and then it's maybe good to analyze a whole mass balance and then take this both in comparison, I think.
I think this is the end of our webinars today. I think there's still a few questions here that we will address via email, if that's okay with the audience. So thanks to Julia for sharing her knowledge with us today. And of course, thank you to all of you who participated, especially the ones who sent those very insightful questions here. So as I mentioned earlier, this webinar will be on the Teledyne Hanson YouTube channel within a few days, and you can watch this on demand. Of course, feel free to share with people that you think can also benefit from this content. And for more information on this webinar or to access any Teledyne Hanson content or products, you can visit our website at teledynehanson.com or find us on social media. Thanks, Julia, very much. So we hope to see everyone in our next webinar. Have a great day.